Well, ladies and gentlemen, it's time for our first keynote of the day. Dr. Devi Shetty was to join us in person, but due to unavoidable reasons, has been gracious enough to join us online. Our first keynote session is titled Shifting Realities and Soaring Possibilities, which also happens to be the guiding theme of Imbue 2025. Delivering this all-encompassing keynote is Dr. Devi Shetty, Chairman and Senior Consultant Cardiac Surgeon, Narayana Group of Hospitals, Bangalore, and Chairperson, Board of Governors at IIM Bangalore. A recipient of the Padma Shri and Padma Bhushan, and with over 100,000 heart surgeries to his name, Dr. Devi Shetty has made world-class cardiac care both affordable and accessible, and is transforming healthcare delivery in India through innovation, empathy, and scale. Let's give a big round of applause and welcome him virtually, Dr. Devi Shetty.
Thank you so much. Am I audible?
Yes, sir.
Yes, sir.
Thank you so much. I'm extremely grateful to the organizers of Imbue for giving me this opportunity to interact with you. I'm sorry I couldn't be there personally to interact with all of you. About what I would like to talk to you today, I don't think I have the knowledge or the wisdom to teach you about the business and shifting realities of business scenario of India. The only thing I know is about the healthcare. So I thought I should talk to you how you can continue to manage your business till the age of 95, possibly till the age of 100. So the next few minutes, I would like to explain to you how you can achieve that goal by doing some simple changes in your life. The first advice I have to all of you is that every one of you must wear a smartwatch. Smartwatch today does a lot of smart things, but in the near future, it will be the diagnostic tool to find out everything happening in your body. So you should get used to the concept of wearing a smartwatch to know your health indicators. When you choose a watch, there are two things it should do. One is it should give the number of steps what you walk, and more than that, you should be able to see your ECG with the 2 taps. So it shouldn't, the moment you feel something wrong here, within 2 taps, you should be able to see the ECG. These are the 2 current requirements. But in the near future, it will give you your blood pressure, it will give you all the parameters of your whatever is going on in the body. The reason why I want you to wear smartwatch is because that will constantly remind you about what you're supposed to do on that day. The medical community has now come to a conclusion based on all the publications we see in JAMA and all the other famous internationally accredited journals, medical journals, clearly shows that if you walk 10,000 steps per day, the incidence of heart disease, cancer, Alzheimer's, and many diseases, the incidence will go down dramatically. 10,000 steps is the mantra to celebrate your 95th birthday with your great-grandchildren. I do not know most of you, but I can tell you that today you're not walking more than 3,500 steps, irrespective of how you feel, how active you are. Now, how is it possible to reach 10,000 steps? Is it difficult? No. If you walk briskly, in 10 minutes, you can walk 900 to 1,000 steps. If you wear a earphone and start walking when you are using your mobile phone, you will add minimum of 2000 to 3000 steps every day without you being aware of it. And believe me, your capacity to think is much, much more when you're walking than sitting. So it is very important for you to get the habit of, when you're talking, get into the habit of walking with the earphone. That will give you a few extra steps. If your office is big, you have enough space to walk. If not, one of the good things technology has done is a walking pad. Today you get these treadmills which can be folded and kept in the office, called walking pad. You can use one of those. Irrespective of how young or how old you are, I strongly recommend all of you to practice yoga. Yoga is the best gift given by India to the world. Let me tell you my experience. When I was reaching the age of 60, I started getting knee pain. And my wife kept asking me to start yoga. And I kept telling her that as a medical student, I was very athletic. I used to win prizes in all kinds of bodybuilding and various karate and all kinds of contests. I said, athletic person like me and yoga, it's not meant for me. I continued to ignore the knee pain. Till the extent that when I was climbing stairs, I was conscious of avoiding the pressure on the particular knee. Then I realized I'm not reaching anywhere, so I started yoga. And I guess within 3 months or 4 months, the knee pain completely disappeared. I was taking yoga just on alternative days for 1 hour on alternative days. Today, if you ask me whether it was the right knee or the left knee, I have forgotten. This is the beauty of yoga, and I became a very, very strong proponent of yoga. Today, I stand and operate continuously. There are times when, as a surgeon, heart surgeon, you need to stand for 5 hours, 7 hours. I can see my young assistants shuffling their feet, getting restless, but I can stand like a horse. This is only because of the yoga exercises I perform. So if you are not, a lot of people, I used to love bodybuilding to show my muscles. That I'm not saying it's not good for you, it's okay. But if you really want to remain fit past the age of 40, without constantly getting reminded by the joints that something is giving way, yoga is the best course for you. Modern day's work involves sitting, irrespective of what job you are doing today. You are sitting on a chair, constantly watching your computer, or doing something sitting, or meeting people sitting, me examining patients sitting. We sit for hours together. Sitting is worse than a cigarette. So my advice to all of you is that every 20 minutes, you get out of the stand up and walk for at least 5 minutes. And that will reset your body posture and the circulation. And whenever you have the option of choosing the location in your office, choose the location next to the window, and every few minutes, look outside. Human beings are designed by God to be with the nature. But unfortunately, we are building walls around us and cutting off our most of the time away from the nature. Just want to give you one observation. When I was a young surgeon at the Guy's Hospital in London, 78-year-old patients, when they had a heart operation, they were getting, after 2 days, 3 days in the ICU, they were getting restless and psychotic. And they were given all kinds of medicines, which caused drowsiness and various complications. A young psychiatrist joined Guy's Hospital, and he visited the ICU. He understood this phenomena. He asked us to stop all the medicines, and he just changed the direction of the table, their bed, facing the window. All the ICU's patients face inward, not to the window. He just changed the direction, and that had a magical impact on the psychosis of the people. So in your house, in your office, always try to sit next to the window. Whenever it is possible, look outside to the nature. You're supposed to be with the nature. Next thing people keep asking me is about what to eat. You are what you eat. In the last maybe 40, 50 years, medical specialists like us, we made a major blunder. The blunder was we blamed the fat for the mischief played by the carbohydrates. As a doctor, throughout my professional life, I was teaching people what oil to take, what is the quantity of oil, what is the impact of fat. But the real villain is not the fat, not the oil. It is the carbohydrate. What is carbohydrate? Is rice, chapati, and sugar. This is the main reason for most of the metabolic disorders people suffer from, starting from diabetes to heart disease to many, many illnesses. So in your diet, unfortunately, Indian diet has predominantly major impact. The major component is carbohydrate. So please restrict the carbohydrate as much as possible. One of the biggest problem is most Indians do not drink sufficient water. It is very important to drink water, especially if you are trying to lose weight. Because past the age of 40, 50, if you do not drink water, your tendons get rigid. It loses the elasticity. And this is one of the main causes of backache and joint pain. You should always have a habit of 1 glass of water being kept on your table. That will constantly remind you that you need to drink some water. About the 2 or 3 liters of water per day is ideal. And especially people who are vulnerable for urinary tract infection, this is a very, very important solution. A lot of people, because of our dietary habits, are overweight. And losing weight, it's very easy for doctors to say that, cut down and lose weight. It is one of the toughest things to do. My advice to all of you who want to lose weight, when you are very, very overweight, there are modern medicines available meant for diabetics, but it is now given for people having morbid obesity. These medicines are consumed by millions of people now over a period of few years. I think it is relatively safe. You should consult your endocrinologist about taking these medicines under guidance, under observation, so that you take it for 3 months or 4 months, you lose about 8 or 10 kilos of weight, then you will be able to manage with some determination to maintain the weight without these medicines. So this is something you could seriously consider. And everyone should know their numbers. All of you should know your numbers. What are the numbers? I want you to know your body weight, your blood pressure. You'll be surprised, 18% of the 20-year-old in India are hypertensives. 13% of Indians are diabetics. So 11 to 12% of Indians are hypothyroid. So if you haven't done a blood test any time, please get it done. You should know your calcium score of the heart. You should know the liver numbers, kidney numbers, and all these numbers. Everyone should know their numbers once a year. These numbers keep changing. And once you know it at an early stage, you can change those numbers. If you have a medical problem, it is very important that all your medical records are kept in your mobile phone. Why mobile phone? Because wherever you travel, you have your medical records with you. Medical records are more important than your land records. You take a lot of precaution for a land record, but you ignore medical records. Why it should be in your phone? Because it should be with you wherever you go. Today, people forget their spouse, but they never forget their mobile phone. One of the fallacy or problem of modern society, especially with the young fit people, is that they do not know that how fit they feel has nothing to do with how fit they are. I'll give you, I just want you to, whenever you're free, I want you to Google FIFA, FIFA, Federation of Football Association, and then write cardiac arrest. You will notice that in the last 6 years, 676 or so professional footballers had a cardiac arrest during the practice section in just 5 or 6 years. This is what is documented. The undocumented will be maybe 10 times more. Who can be more fitter than professional footballers? Why they had a sudden cardiac arrest? Always you see in the TV some CEOs of a billion-dollar company on a treadmill they collapse, or young famous celebrities had a sudden cardiac arrest. It is not a sudden event. If all these people had a proper evaluation, especially of the heart, none of them would have died. None of them would have had a cardiac arrest. If they had a test on the heart 10 years earlier, all these deaths could have been prevented. It is sad that in India today we are 1.4 billion people. Every day before 7 o'clock in the evening, few thousand people develop heart attack, sudden cardiac arrest. Few thousand people die. Every day before 7 o'clock, few thousand people will be told that they have an advanced cancer for which there is no cure and they're going to die. If 365 days earlier, 1 year earlier, if they went for a checkup, got their heart and the kidneys and all the other body parts examined, none of them would have had a cardiac arrest. Their blockage would have been diagnosed, they would have been treated. None of them will be diagnosed with end-stage cancer. It will be early-stage cancer for which there is cure. So essentially, all these tests today are available in a manner that you can get all the tests done in less than 60, 70 minutes. It is possible. So one day every year, take 60 minutes off from your busy schedule, get the test done. Now, the last thing I want to talk about is in all your families, you have seen people who do everything what they are not supposed to do, but they live till the age of 95 happily. And the people who did everything right had a cardiac problem or cancer or whatever at the early stage. Now, why this happens? This is because of the genetic predisposition. I will just give you some percentage, it's not very accurate to simplify it. About 25% of the people, irrespective of what they do, they will develop heart disease, heart blockages. Even if they live like a monk, they will develop because of the genetic predisposition. And there are about 25% of the people, they can drink like a fish, smoke like a chimney, nothing ever happens to them. The only way they will die is you have to shoot them down. But there are 50% of the people who are fence sitters. If they do things what they are not supposed to do, they land in trouble. If they take care of the health, they may develop a cardiac problem or some other problem, but at a later date, later stage. So my advice to all of you is to you think that you belong to the that fence sitter class and you should do everything right. So this is my advice, and I'm extremely grateful to you for giving me the opportunity, and I hope I did not spoil your mood talking about the health. Thank you so much.
We are